My name's Rob Slater. I'm an orthodontist. I've been a specialist now since 1997, which makes me feel quite old because it's about 28 years. I've also always liked doing a little bit of teaching while doing the job, and so that's why I'm working with Identity. Postgraduate diploma is really a course for people who've got a little bit of experience with orthodontics and are just wanting to take that experience a little bit further. I think one of the biggest difficulties when people are trying to introduce orthodontics into their practice, well, there are a few actually. I think one is that there are companies that want to sell their products to them, but also there is a bit of a dearth in terms of the practical experience that people can gain on a day-to-day basis. So we try and fill that gap by talking about the science behind orthodontics, what the evidence base is for certain types of treatment. And we talk about the mechanics, but also the day-to-day treatments and how one can carry out those treatments and do practical adjustments to give the patients the best chance of a good result. The key skills that people will master by the end of the programme are firstly learning a lot more about detailed treatment planning so that when going through consent with patients and their parents, they can actually talk about the different options that are available and the pros and cons of each of those options. But also we do some practical wire bending exercises which can help inform the way that some of those treatments will be carried out. The learning environment here is relaxed. I like it to be not just one way, so didactic teaching can be useful. I much prefer this to be a two-way thing, and I want people to feel like they're relaxed enough that they can ask me any question that they want without fear of reprisal. In an average day, what we do is we ask people to firstly talk to us and ask questions while we're actually doing the talks, but also we do some practical exercises. It can become rather boring in the end if you're just listening to lectures, but we also get people to bring along cases that they might have problems with that they can talk about, and then we can talk about what options might be open for them to treat them in the future. The support that delegates will receive after they've been on a course is that they can become involved with the forum so that they can get advice when treating their patients. I've also had people contact me after the course on a personal level just because they have a case that they want to discuss with me, and I'm always open to that if people are interested. I think the ideal delegate for this course is somebody who really has a passion for dentistry, is interested in orthodontics. Ideally, they should have done the postgraduate certificate in orthodontics, and if they've done that, then there's a lot that we can do to help support your orthodontic journey. This course prepares people for real-world orthodontic cases because it's not a cookbook approach. What we want to do is really, first of all, examine the patient and work out what the specifics are. They could be facially as well as dentally, and bring all of those things together so that we can work out, using basic mechanics, how we're going to move the teeth. Once we've done that, we think about the vehicle that we might use, and that really only comes at the end. And I think that learning that process will help people to give their patients perhaps more options, but also talk about the risks and benefit of each of those options, which helps in giving valid consent to the patients.